The world-renowned flying doctors have turned themselves into flying dentists, trying to tackle a lack of dental care outside our big cities. Nearly 40% of Australians don't have easy access to a dentist, and in the Outback, doctors say the situation is now a disgrace. Cheryl Taylor has our exclusive report.
The Royal Flying Doctor Service began as 24-hour emergency assistance, but has expanded to provide health clinics, recently honing in on much-needed dental care.
And in fact, our dentist looked at patients' teeth in rural Australia and said they're actually in a worse situation than the teeth that he had seen in developing countries.
That prompted this 3-year trial program dubbed Tooth. It got off the ground thanks to $2.5 million funding from the Investec Bank and Gonski Foundations.
And of real concern there is the tooth decay that we're finding amongst children, which is about 5 times the population average.
Most people haven't seen a dentist in more than 2 years.
It's sad to see the state of the dental health out here with high rates of dental decay in children and adults.
But the Flying Tooth team is already having positive results. After just 4 months, they've done extractions, fillings and root canal therapy on more than 400 adults and children. And also delivering on another aim, training more rural dentists.
We're actually beginning to prevent the dental problems of the future.
The federal government has identified rural dental health as a priority, and the flying doctors want the government to fund their proven good work, not recreate the wheel.
We would say keep the flying dentist flying.
Cheryl Taylor, 10 News.